Wellness Waves, a podcast by Fortis Healthcare to discuss health and wellness-related topics with nationally renowned experts from Fortis. Join us on this enlightening journey and ride the waves of wellness.
Welcome to New Hips, New Life, the wellness podcast that helps you navigate hip replacement surgery. I'm Jida, heading physiotherapy and rehabilitation at Fortis Hospital, Bannerghatta Road. Today, we have Dr. Narayan Hulse, Principal Director of Orthopedics and a Senior Joint Replacement Surgeon at Fortis BG Road. He is a pioneer in robotic joint replacement surgeries in India. He has the credit of doing the first robotic direct anterior hip replacement in the country. Let us discuss today about the latest developments in the hip replacement surgery, including robotic technology and direct anterior approach. I welcome you, sir.
Thank you, Jita, for that warm introduction. And also welcome to all the viewers of this podcast.
Hip replacements are one of the best solutions for painful hips, and let us discuss the latest developments in the hip replacement surgery today. What are the latest advances in hip replacement surgery?
So the hip replacements, even though have been conducted since last about 70-80 years very successfully, there are a lot of advances and technological advances have come in last maybe 2 or 3 decades. Hip replacement is a surgery where we replace the ball and socket joint at the end of your thigh bone, that is in the upper aspect of your thigh bone in the groin. When the patient is having severe pain in the hip joint, hip replacement is one operation which will give them tremendous pain relief and also restore their mobility. And hence, this operation was once termed as the operation of the century because the success rate of this operation is tremendous. Even though a lot of developments have happened in last century, 2 latest advancements with this surgery are Direct Anterior Approach, which is becoming popular in last 2 or 3 decades, and also introduction of the robotic technology for the hip replacement. And hence, to be frank, there are 2 main advances are Direct Anterior Approach, and the second one is introduction of robotics into surgery.
Sir, you have explained about anterior approach. Sir, can you just explain what is a direct anterior approach for hip replacement surgery?
Hip replacement, or for that matter, all the surgeries are done through cutting through the tissues to reach the point of our surgery. For example, in the hip replacement, traditionally, hip is approached through a cut on the side of the hip joint or through the posterior aspect or back of the hip joint. However, when you make a cut on the side or on the back of the hip joint, it involves cutting through a lot of vitals, important muscles of the hip joint. And also, if you damage these hip joints, if you damage these muscles, we may have problem in terms of rehabilitation, walking strength, the healing, bleeding, etc. And hence, in the direct anterior approach, instead of making a cut through the posterior or back of the hip joint or from the side of the hip joint, an incision or a cut is made through the front of the thigh. Advantage is that because you are cutting through the front of the hip joint, we can reach the hip joint without damaging any vital structures. What we call this as an internervous plane or an intermuscular plane. So the direct anterior approach, to be concise, involves making a smaller cut from the front of the hip joint rather than an extensive back incision or a side cut for the hip replacement surgery.
This anterior approach, is this very popular in the world?
This approach is gaining popularity all over the world. For example, this direct anterior hip replacement was actually done from many years only in very limited centers, but it wasn't done very commonly all over the world for the reason that it required special training, more skill, specialized instrumentation, and also special operation theater equipments. And hence, this wasn't popular for many years. However, to our own surprise, in the last 2 or 3 decades, this direct anterior approach has become very popular in most of the countries. For example, in American Hip and Knee Society, there was a survey done few years ago which showed more than 50 or 60% of surgeons have already changed from their traditional approach to do a direct anterior approach. And hence, probably in the last 1 decade, the one surgical technique for the hip which is gaining most popularity compared to any other technique is probably direct anterior approach. That should tell you that how good this approach may be, and there must be a lot of reason why this anterior approach is becoming more and more popular exponentially all over the world.
It is very interesting to know that this anterior approach is becoming more interesting and more worldwide. Now we'll move on to the next question. What is the benefits of this anterior approach?
Direct anterior approach is done making the patient lie down on the bed supine straight, whereas other approaches need to keep the patient on the side. Now, keeping the patient supine or straight on the operation table is very, very helpful for the patient's comfort because he is lying down straight on the bed during the surgery. And also it makes the anesthetic experts to administer anesthesia medicines very easily. And also the anesthetist can handle the patient very nicely on a straight supine position rather than on the side position. And also keeping the patient supine straight on the operation table is easy, and hence it saves time. It also saves time in terms of keeping the patient on the side with varieties of the supports needed on the table. And hence, patient positioning is easy. Patient positioning on the operation table is quicker. And also it's easy for the anesthetist to administer anesthetic drugs. And also it's easy for the anesthetic people to maintain the patient if there is any anesthetic intervention is required during the surgery. And then this operation, as I was describing you earlier, is done through a small incision, small cut on the front of the thigh. What it makes is that we are not going to cut any of those muscles, any of those important structures around the hip, rather we go between the muscles. That makes bleeding is less, the operation time because of lesser intervention required becomes quicker. And also, because the patient is lying down supine or straight on the table, assessment of this patient with an X-ray or a fluoroscopy becomes very, very easy. And also, one of the most important aspects of a hip surgery is keeping the leg length equal, because we want to make these patients' leg equal on right and left side. Because if you are operating on one side, we cannot have a patient who have a longer leg or a shorter leg on one side, which becomes very difficult to assess when you are doing an operation in a side position. Whereas in a straight or a supine position, anybody can assess whether the leg is straight or whether the leg is equal or not. And hence, manually measuring the leg length becomes very easy in a supine or a straight position. And also you can imagine to do an X-ray for a patient in a supine straight position is much easier. And hence on the operation table itself we know, and we have confirmed by doing an X-ray in a proper position, that the component position is good and also leg length is equal by doing all this technology, which is easy to do on a supine position rather than keeping the patient on a side position.
Wow, this makes everyone's life easier actually. So what is the benefit for the patient from this approach?
This approach has several benefits to the patient. You can imagine that a surgical new approach is becoming so popular exponentially all over the world. That means only one thing, that it has got a lot to give to these patients. These patients benefit immensely from these kind of advantages rather than just technological advances on paper. What are the benefits these patients are going to get? The most important thing is this is a skin cut or a skin scar which is only about 8 to 9 centimeter. Whereas the traditional approaches will require about 16 to 22 centimeter incision, making it like less than half cut, less than half the length of the scar on the skin. It is not just the cosmetically better scar, making the scar or incision less also has lesser damage to the patient. Patient has less pain because it is a smaller operation, smaller surgery, smaller cut. Next benefit these patients are going to get is early mobilization. These patients can move early because their muscles are not touched. Another advantage these patients get immediately after the surgery is when they are lying down after the operation on the bed, they get pain from their scar if it is on the back of the hip joint. Whereas if the scar is on the front of the hip joint, they can easily and with very ease, they can lie down on the bed without pain. In fact, they can turn to the side also a little bit because the scar is not on the back of their hip where they are going to put pressure when they are lying down. Then other main advantage these patients have is a leg length equality. For example, after the surgery, one of the most common problem is a leg length discrepancy. In all studies, it has been shown that they get equal leg length, left and right, whether you have done both sides together, because as I was telling you earlier, fluoroscopy or an X-ray can be done on operation table. Because they are lying down supine straight on the bed, the surgeon can measure the leg length properly, and also we can use a robotic technology to measure the leg length. With all these gadgets, with all these techniques, with the supine or a straight position, the leg length becomes equal. Next thing is after operation, you all may be aware that we'll have to cut through the tissue to reach the hip joint. If you do a side cut or a back cut, these patients can have limp because the muscles have been damaged. So the limp has been shown to be very good or not there in those patients who have direct anterior approach because their muscle is not damaged. There are several studies which have shown it very clearly that the patients who have direct anterior approach have early recovery and lesser limp, lesser dislocation, lesser leg length discrepancies, as well as many other benefits, especially in the first 6 to 12 weeks after surgery. Of course, the first 6 weeks and 12 weeks after surgery are very, very important for these patients during the recovery, because that is a time when we are all stressed out. That is a time when the patient has to go through a lot. That is why these approaches, because of their tremendous benefit in the early part of their surgery, have become exponentially popular all over the world.
That sounds very significant improvement in terms of recovery. You were talking about the equal length of limb. So can you just explain how do you achieve that? Or, little more clarity if you can give, it will be good.
Achieving correct limb length or the leg length is very crucial for these patients, both in terms of their cosmetic appearance and also for the function. If the limb length is not achieved properly, other than limping, they can also have back pain, etc. later. In the direct anterior approach, it is easier to achieve the leg length very predictably. By 3 mechanisms, we do that during surgery. One of the mechanism is, because these patients are straight supine on the bed, we can visually check whether the leg length is equal or not. If not, we take the corrective measure. Second mechanism is that we can do an X-ray easily on the supine straight position rather than on the side. So in the supine position, in the straight position, we do the X-ray of both the hips and we compare, we measure, and we make sure that their hip length is equal. Third mechanism is introduction of the robotic technology. As you may be aware, the robotics can calculate even a fraction of a millimeter. And hence, we calculate their hip using the robotic technology, which makes our job much easier to get the leg length equally. And hence, the latest with this technology, with the direct anterior approach, is its combination, is introduction of the robotic technology.
That is great, sir. Lots of information for our viewers about anterior approach of hip replacement surgery. Now, you were mentioning about the robotic surgery. Can you just explain how the robotic surgery in hip replacement?
As you may be aware, robotic technology is used in every aspects of our life now. And the robotic technology has entered our operation theater also for many years. Nowadays, this hip replacement surgery is done using a robotic technology all over the world, and it has been tried and tested since last 15 to 20 years now, and it is becoming more and more popular all over the world. In the robotic hip replacement, what we do is we get a CT scan of the hip joint of the patient before surgery. Obviously, the CT scan will give you a 3-dimensional measurement of your hip, or virtually we can make a virtual model of your hip even before the surgery. Even before the surgery, we know the dimensions, we know the size of the instruments which we are going to use inside the hip joint. We call them as implants. So once the CT scan has been done, during the surgery, we match your hip anatomy during surgery to the robot which has already got your virtual model. And hence, everything what we do on your hip joint will be mapped with a CT scan which is already available in the robotic machine. And hence, what happens is every measurement, every axis, every angle, what we have to learn, what we have to calculate, what we have to reproduce during surgery will becomes easy. So using the robotic machine, we also execute a plan which is done pre-operatively very accurately. For example, your hip socket as well as the hip stem is prepared with the help of the robotic machine. And hence, the planning becomes accurate, as well as the execution of the plan on the patient's body also becomes accurate. And hence the robotic technologies are being used more and more often, so that the precision of your hip replacement becomes easier, because we will not be able to calculate certain angles inside your body easily using our open eyes, whereas a robot can calculate all those angles in a 3-dimensional view.
Actually, that was an eye-opener. Really amazing. Robot in the operation theatre. Oh. Sir, how do you combine this robotic and direct anterior approach surgery?
These two are the latest technological advances. Now, the direct anterior approach, which preserves tissues, and also so far you learned what are the advantages of the direct anterior approach. Whereas the robot, if it is combined to the direct anterior approach, it is like you have a biological improvement by not cutting more of the tissues. You have a technological advancement which increases precision of the hip replacement surgery. And hence it's been shown all over. The direct anterior approach combined with the robotic technology will definitely improve the precision of the hip replacement surgery. And in the long run, it may give you a lot of benefits in terms of varieties of the outcomes which are related to the hip replacement surgery, which of course we will know only over a period of time. And hence, a direct anterior approach which preserves the biology is combined with a robotic technology to do the precise activity or a precise surgical precision on the table on these patients during the hip replacement surgery.
That is really interesting, sir. Does the robot do the surgery in the operation theatre?
No, actually for a lot of common people, it looks like, oh, will I be under the knife of a robotic machine in the operation theatre? I think we have not advanced so much in the world yet. Robotic surgeries are also called as a robotic-assisted surgery or a robotic arm-assisted surgery. All these robots currently work under the direct supervision of a trained surgeon. And in fact, the hip replacement or a knee replacement surgery called robotic surgeries cannot be done without a surgeon actually doing the surgery currently. So hence, these are all in reality are robotic assisted surgeries. Only thing robotics will do is they do the complex activities, surgical precision, which the human eyes cannot do. In reality, in the operation theatre, the surgeon is doing all the steps of the surgery, where the robot will be surgeon's hand, which will help him to do the activities very precisely. And hence, nobody needs to be worried that will it going to be a surgical robot and the surgeon is at home and the surgery is done by a machine and what will happen to me if something goes wrong. It is not that way. These surgeries are done with the help of a robotic arm called robotic arm assisted surgeries.
Now our viewers will be more curious to know what is happening after the surgery. So can you just explain one experience or patient? How do they do post-surgery?
Direct anterior robotic hip replacements has been done for several patients, over 100 in the last year by me in this hospital. And there is nothing more gratifying to a surgeon than your patient walking nicely and he's pain-free and he's back to his action or activities or sports, what he would love to do. There are several such examples and each one is so interesting, and also they have the human touch of improvement in their pain and mobility. One of such example is this software engineer who works abroad, and he developed this COVID, and he had to be admitted in a hospital which required a steroid administration that left him with avascular necrosis, or something we call as a bone cell death. As you may be aware that when the bone gets damaged inside the hip joint, they have a persistent, permanent pain in that hip joint, and which will come in their activities of daily life. This gentleman who was suffering from pain from months and months, and he spent about 2 years visiting several doctors in his country. He was abroad. Then he came back and he consulted several doctors, at least in 2 of the metro hospitals in India. And then he also underwent 2 smaller surgeries in his both hips. Of course, both of them didn't cure his problem, and the results were complete, utter failure in terms of the pain relief and mobility. Then he was looking, being a software engineer and an educated guy, looking for something better to restore his activity back to his sports career, as well as getting back on his feet very quickly. And then he visited us, and he was so curious, he was so stressed out, and the emotionally burnt out that in a young age he's supposed to have a hip replacement surgery, and he wasn't sure what is exactly his life after the surgery. He underwent 1 surgery on the left hip using a direct anterior and a robotic hip surgery in the June of 2024. We made him walk on the same day. Within a couple of days he was up and about and very quickly got discharged. To our own astonishment, within 3 months he returned back saying that, "Doctor, my first hip is amazing and I would like to get the other one done tomorrow." So he got the other hip as well done, and he recovered so amazingly well. Today, to all our surprise, this gentleman walks as if nothing has happened to him. His wife is a pathologist doctor. You can imagine that how much happy the whole family would have felt, the gentleman himself would have felt after suffering from 2 or 3 years of pain, and with the despair that will I ever get better or not. This gentleman back on his feet as if nothing has happened to him, and he's back in all his activity. And that opens our eye that even with so much of problem, so much of disability, so much of pain, these patients can get back to normal activity, provided that they get correct time in a correct technological advancement if it has been used, and they can be normal.
Finally, what is your message to our viewers?
After the COVID epidemic, we started getting a lot of patients with hip pain because of the avascular necrosis of the hip joint called AVN. These are young patients, along with other elderly patients who already have a hip problem. We can deal with them with the latest technological advances so that they will get back to their activity and sports and their livelihood without pain. In the armamentarium of these surgeons, currently we have 2 latest advances which have been tried and tested all over the world. One of them is a direct anterior approach, and another one is a robotic technology for a hip replacement surgery. Combined direct anterior approach as well as robotic technology is actually improving the results in these patients. And also we are so proud that in our center we can provide both these technologies to our patients so that they are back on their feet and their pain is relieved and their mobility is restored.
Thank you, sir. Really, it was very informative, and thank you for your valuable message.
Thank you very much. And also thank you for all the viewers.
Thank you to all our viewers for tuning in. We hope you found this podcast helpful. Stay tuned for more discussions on the latest advancements of medical treatments. Goodbye for now.